morning, viewers. You are still with me, Yohana Dian Ambarwati. I will accompany you to listen to some break news, some actual news, and some latest news in the sunny morning. The first is artificial pancreas to revolutions. Diabetes scare in England nearly 900 patients with type 1. Diabetes in England are testing a potentially life-changing artificial pancreas. It can eliminate the need for finger pricks tests and prevent life-threatening hypoglycemia attacks where blood sugar level fall too low. The technology uses a sensor under the skin. It continually monitoring the level and a pump automatically adjusts the amount of insulin required. 6 years old Charlotte from Leicester is one of more than 200 children using the hybrid closed-loop system. Her mother, Abbott, told us it has a massive impact on the whole family. Prior to having the loop, everything was manual. She said at night we have to set the alarm every 2 hours to do finger pricks and correction of insulin in order to deal with ups and downs of Carlotte's blood sugar. About 400,000 people in the UK have type 1 diabetes, a condition where the body can produce insulin, the hormone which regulated blood sugar level. In his England is the first nation with test of the technology in the world, and it comes 100 years after the first diabetes patient received insulin injection. The hybrid system is not completely automated because the awesome of carbon hydrates being added at multimass need to be inputted. Charlotte's consultant Dr. Mine and pediatric endocrinologist at Ormiscrete District General Hospital. This new technology has good potential. I think this absolutely fantastic. I've been practicing for 25 years children diabetes, and it's a game changer, she said. To be able to improve the quality of life, to be able to see that most of their blood glucose reading at need that the target range, it's very exciting. For angst, the constant monitoring means that Charlotte can go back to being the children she was. She loves days out with her friend and sleepy force. But we had to stop just as soon as she was diagnosed because other people could manage her diabetes. Now we can allow her to go out for these social occasions when we're not there. Yasmin Hopkins, 27 from London, has also retrieved an artificial pancreas as part of the pilot. She was diagnosed with type 1 diabetes 50 years ago and had struggled to maintain her blood sugar level. Yasmin told us she find the new technology liberating. I wake up now and I can do a normal day's work or go on a dog walk without being concerned, she said. Before, I feel like I have been a risk from some of the long-term complications of diabetes, whereas now I don't see that happening. If blood sugar levels are not kept under control, diabetes patients risk long-term damage to their heart, kidneys, eye, and nerves. Professor Partakar and his National Specialty Advisor for Diabetes said having machines monitoring and deliver medication for diabetes patients sound quite achieve like, but technology and machines are part and parcel of how we live our life every day. It's not very far away from the holy grail of a fully automated system where people with type 1 diabetes can get out get where people with type 1 diabetes can get on with their life without worrying about glucose levels or medication. Chris Asquith, chief executive of Diabetes UK, said, "This technology has the potential to transform the life of people with type 1 diabetes, improving both their quality of life and clinical outcomes." To date, 875 patients have joined the pilot, which will enroll up to 1,000 people. The result will be part of an assessment by the National Institute for Health and Care Activities, which is considering where to roll out the technology more widely. It's come after NICE recommended that everyone in England with type 1 diabetes be offered some form of continuous glucose monitoring via a sensor attached to the skin. Okay, this is the news that I read